All right, let's talk about newborns. Now, you may not have a child of your own, but you may be exposed to children, to newborns, through your friends, through your family members, whatever. So there are some important things about newborns to discuss, and this video covers like this tiny minuscule fraction of it. But these are the things I chose for you. First of all, people often describe birth as trauma. And that's just something to kind of keep in the back of your head, that it is sort of a giant change for both the birthing parent and for the newborn. The newborn who was tucked inside the uterus, inside the amniotic sac, filled with amniotic fluid, a world where sound was muffled and vision was limited, out into worlds with a lot more sound, a lot more visual stimulation, a lot more tactile stimulation, people touching the newborn. Okay, so this is a lot to adjust to, a lot of change. Aside from the normal birth process, well, normal is kind of relative, but aside from birth itself, sometimes birth injuries do happen. And there are many types of birth injuries. Okay, so we're going to just talk about a few. Okay, let's talk about bruising and swelling. This is very common. Sometimes the eyes can be bloodshot from it. Sometimes the swelling and bruising is much more pronounced. One of the reasons this can happen is when the baby is born, it has to get birthed through the birth canal, but it has to kind of wiggle around the pelvic girdle of the birthing parent. And sometimes during a push, or sometimes when the water breaks, the baby actually bunks into those pelvic bones. And that itself can be traumatic and create some bruising and swelling. The head shape might be altered. So remember, crowning, okay? The head presents first. So through constant pushing, and then the baby is not ready to be born, and pushing, and the baby is not ready to be born, and pushing, and the baby is not ready to be born, it can result in some malformations of the head shape. Now, these are usually temporary and resolve within a few days. This can also happen due to vacuum suction, if that is used as an attempt to aid delivery. We have forceps marks. Okay, so if forceps are used to aid in delivery when the birthing parent is struggling to birth the baby, it can leave marks. Okay, and you can have broken bones from the delivery process. So right here you can see that's the bump from a broken clavicle. The clavicle is the most common bone broken during delivery. So if you think about it, it makes sense. So remember, face down during delivery, which means the face of the baby is facing toward the posterior of the birthing parent. So that's normal, although that is not the only position that a baby is born in. But as the baby is being born this way, head comes out, turn, tuck the shoulder. Well, in that process, especially for a larger baby, it can result in a broken clavicle. Okay, just one of the ways. But also the long bones in arms and legs, including the femur, can be broken in delivery, although the clavicle is simply the most common. Most of the time, the treatment for the clavicle break is make sure the bones are lined up right and just let it heal. Check to make sure that there is the soft callus formation, and then just let the bones heal. Sometimes babies do have complications from their birthing parent. One of those is fetal alcohol syndrome, which has a lot of distinct facial indicators. This is a result of a birthing parent who consumed alcohol during pregnancy, during critical stages of development, especially for neurological development, but you can see also for other features. Babies can be born addicted. So we did talk about drugs and alcohol and how taxing withdrawal can be on a person, and how withdrawal from alcohol and sometimes with other drugs can be life-threatening. if the birthing parent consumes drugs while pregnant on a regular basis, the baby can be born addicted to those same drugs, and the baby will suffer withdrawal. Not only does the baby have to go through withdrawal, but may have potential neurological, muscular, so in terms of milestone delays, because the consumption of the drugs during pregnancy most likely affected development. But when we talk about birth as trauma, if a baby is born addicted and needing to go through withdrawal immediately, that is definitely increases the amount of trauma. A folic acid deficiency can result in spina bifida. That's not something that is a guaranteed, and it is not 100% of the time, which is why prenatal vitamins contain folic acid, help mitigate these neurological defects due to the lack of folic acid. Syphilis is one of the illnesses that if the birthing parent has this illness, it absolutely can get passed to the developing fetus, and the fetus would be born with symptoms related to the progression of untreated syphilis. Okay, and this statistic says 50 to 80% of exposed neonates will develop their own case of syphilis. There are other illnesses that can cause potential issues as the developing fetus builds a brain, builds a spinal cord, builds organ systems. And some of those include bacterial vaginosis, chlamydia, hepatitis, HIV, AIDS, HPV, Lyme disease, and a lot more. What the birthing parent eats, drinks, chooses to use in terms of drugs, whether that be over-the-counter drugs, prescribed medication, or illicit drugs. All of those things should be considered in terms of the health of both the birthing parent and the developing fetus. So what are newborns like? Well, okay, umbilical cord. So while in utero, the fetus was attached via the umbilical cord to the placenta was providing nutrients, and they passed to the developing fetus through the umbilical cord. Now, that cord is eventually cut. Now, some parents choose to leave that cord attached until the last of the blood kind of pumps out of the placenta. But whatever, eventually it needs to be cut and tied off. And then it will go through this sort of healing process. At the end, maybe you could end up with an innie or an outie. That's irrelevant. Okay. This is healthy healing. Okay. You're not going to want to pull it off. Just let it come off. Keep the area clean and dry. Notice this is not red. You don't see any pus or any inflamed area. So it may take longer or less time for the umbilical cord to fall off. Just kind of let it happen. Don't force it. Okay, so newborns have developing vision. They don't see great. So look at that vision of a newborn. They can kind of see shadows. Now, what's important to note is that the distance from the eyes matters, because you can see even as the baby is developing, things in the distance don't get seen for a while. Okay, so want to kind of know the perfect distance. So imagine this, either holding a baby to chest feed or holding a baby to bottle feed, that distance from your face to the baby's face. That's kind of about the perfect distance for what can be seen initially until vision continues to develop. So here's another example. Again, newborn really only seeing shadows, not beginning to see color until around 3 months of age. So having stark contrast, black and white, is most beneficial for what newborns can see and to help them train their vision. Having a whole bunch of pastel colors does not really help. Newborns eat often, like 8 to 10 times a day. Now, they only eat about 2 to 3 ounces at a time because their stomachs are very small, okay? But they do eat often. And some early cues, which you can see here, if a baby is showing evidence of rooting, mouth opening, turning their head, these may indicate hunger before a cry. Newborns sleep about 14 to 19 hours per day. Most of the time they sleep in short 2 to 3 hour bursts, hence a lot of feedings. It's important to note babies should sleep on their backs with no blankets, no pillows, no soft objects, okay, so that they don't impede their airflow. Okay, now you can see this baby is wrapped in a blanket though. So why did I just say that? Well, swaddling helps. So remember that Moro startle reflex? Swaddling helps to lessen the effects of that. It's okay to swaddle your baby until they can get themselves out of it, and then they have a loose blanket. So swaddling is just fine until that time you go to get the baby after a nap or after a night of sleep and their arms are out. Okay, it's time to stop swaddling now. Okay, now it may have just been that swaddle, you didn't do it tight enough, but again, if the baby can get themselves out of the swaddle, it's not safe to have that blanket anymore. Babies will often sleep smile. That's really common. Babies will typically social smile. So in response to you, okay, as an example, around 6 to 8 weeks of life. I like to say that this happens right around the time when you are really struggling. This human being who 100% depends on the care of for everything, and then they start smiling. So babies can have noisy breathing. A lot of times it's due to the larynx is soft tissue and it's like floppy. So it sounds like wheezy, rattly sometimes. Obviously, check with a medical professional to be sure, but a lot of times that noisy breathing is just due to that floppy tissue in the voice box. Babies can be born with jaundice. So why? This is ridiculously common. The liver is immature, so jaundice means that the baby has high levels of bilirubin. And where does bilirubin come from? From the breakdown of red blood cells, and then that has to be processed by the liver. Now, in utero, the placenta removed the bilirubin and took care of the problem. But once the baby is born, the birthing parent's liver can no longer do the job for it. It must do the job on its own. So you can sometimes tell in the whites of the eyes, which are yellowish, or the yellow skin tone. How do you treat jaundice? Feed often. So sometimes it lingers a little longer in breast or chest fed babies, but it's just important to feed often. Kind of flushing it out of the system will help. Also, phototherapy. So in the hospital, they could put the baby under the lights. They may give directions for a certain amount of time to put the baby in a window with sun shining in. Okay, but follow a doctor's directions for that. Again, the most important thing, whether you are bottle feeding or whether you are chest feeding, feeding often so that gets flushed out. Now, remember, the initial phase in human milk is colostrum, which is thicker and there's less of it. So that might be part of the reason why it takes a little longer in breastfed babies or chest fed babies for jaundice to kind of resolve itself. There can be diaper rash. Okay. There are lots of options to treat diaper rash. One of the best things is to let the baby be without a diaper for a little while. Some air, expose it to air, okay, because that closed environment can help aggravate a diaper rash. Also, changing the baby often. So not leaving the baby in wet or soiled diapers can help mitigate diaper rash. Also, sometimes it's because of an irritant in their diet, and if that baby is chest fed, it could have been an irritant in the parent's diet. Okay, or the formula might not be the right formula for them. Okay, so there are a lot of reasons, but make sure that you are caring for the diaper rash. Creams help to keep a barrier, but regular changing and some exposure to air are key to helping resolve a diaper rash. Sometimes babies are born tongue-tied. So the frenulum underneath the tongue, you can look. Not everyone has the frenulum in the same spot. It doesn't extend out as far in everyone. If a baby is tongue-tied, sometimes that interferes with chest feeding, and sometimes it interferes with bottle feeding, and sometimes it doesn't play a role until that baby is ready to eat more solid food, and it can present issues with, you think about how you have to move your tongue around in your mouth in order to chew food, move it around, and that frenulum can present problems. So sometimes it does need to be clipped as a treatment, okay? Something to check and speak to a medical professional about. Not only tongue-tied, a baby could be lip-tied. Now, why is this important? Well, for breastfeeding, the lip has to kind of be flanged up like this, okay? And if a baby is severely lip-tied, they would not be able to latch correctly, which could create feeding problems. Babies can get acne, and usually in the first 6 weeks of life. They aren't exactly sure, although the theory is it relates to the birthing parent's hormone levels and how those were passed along the placenta. Okay. Cradle cap, sebaceous glands, those oil-producing glands can sometimes be overactive. It's most common on the scalp, but it can be in the eyebrows, under the arms, in the diaper area, around the ears as well. So talk to a medical professional about what they think might be the best treatment. Okay, colic can be common and very frustrating for the parents of a newborn who are experiencing a colicky baby. So if you think that your baby cries excessively, has a lot of clenched fists, has their knees drawn up, sometimes it has to do with excessive gas, harder to comfort, speak to someone to see if there might be some way to relieve an issue that might be present. A baby can also get thrush. That's a fungal infection. It looks like white clumps on the tongue. This is different than like milk tongue, because remember, a baby's either drinking human milk or formula, and so sometimes there's like a coating on the tongue. This is different, and it would be on the cheeks as well, often on the roof of the mouth. Okay, that's not going to be the case if it's something just like milk tongue. And that is a little bit about newborns.